Hi, I'm Rob MacIsaac, and I'm here with...
Hi, I'm Laura Sheehan. I'm the Clinical Manager on 7 South Acute Stroke.
We're here today to talk about 3 things you should know about CQI.
So the first thing you should know about CQI is it helps us to better understand the business of our unit.
What is it about the system that really helps you better understand your business?
So I think it helps on 2 different ways. It helps me as the manager. Every morning I have dedicated time with my charge nurse to sit down, really understand what their key pressure points are. But I think it helps our staff to understand our unit better as well.
Is that because you've got the daily huddles and people are raising issues in the daily huddles and there's a kind of, collaborative approach to dealing with these things?
Yeah, definitely. I think having the opportunity to talk each morning as a team about the issues that are impacting us and really to problem solve together makes a difference. I think also CQI has helped to expose some of the unit metrics that we look at to our frontline staff. So the second thing that you need to know about CQI is that small changes deliver big results.
So this is sort of like the pebble in your shoe. It's like, in some respects it's not a big deal, but it is a big deal, and when you change it, it actually has a big impact on staff.
Yeah, absolutely. We've had a couple of opportunities, and there's actually one that we're working on right now. So we have extra medication stored in our AccuDose, and the nurses will access those meds, particularly on night shift. And we had a staff member put an opportunity up that they were often going either down to the 5th floor or to the ICU or sometimes to the Regional Rehabilitation Center to get medications on night shift, which is a lot of extra time for them. It's also a safety aspect. We have less staff around on nights, so if you have someone going downstairs, it leaves even less people on the unit. And so we're working on this to add, really it's just 2 extra medications to our AccuDose, but it's going to save our nurses a lot of time. The third thing you need to know about CQI is it helps us to solve issues across multiple units.
So how does that work? Is there like a formal structure in place that allows for that kind of cross-departmental, cross-unit communication?
I think it comes really naturally from the frontline staff. So I've seen it happen where the staff members, so 7 South is the acute stroke program and BT North is our rehab partners. And we work really closely together. So sometimes our staff will put issues up that affect both of us on each of our boards. Also, another example was our nursing staff on BT North had raised that we needed to have a more standardized transfer of accountability process. So when that went up on their board, they realized they needed us to be involved as stakeholders and reached out to our team to be involved in that.
So I was really impressed with the work that Laura is doing here in the stroke unit. CQI is part of a much bigger transformation that's going on across the whole of HHS. But having said that, there's nothing that we're doing that's more important than CQI. I really like the fact that as we continue to roll CQI out, it's leading to cross-unit kinds of changes. And healthcare is a team sport. And if one unit is not helping another, it makes a big difference to the quality of care that we can deliver to our patients. And so really baked into this whole system is a way for units to work together to all for the benefit of better quality for our patients. So thanks very much for listening, and we'll see you next time.